At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Fibromyalgia on Wednesday, June 12th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Welcome, everybody. Dr. Tom here. And it's a beautiful Sunday, actually. I was a little concerned whether we were going to get some rain. Maybe still, but, I think we're good to go right now. Anyway, welcome to Dr. Tom Roselle Live. And, this is an interesting week. We've got a lot coming up, and we're going to tell you all about that. But we're going to get back into the pattern of talking about chronic pain syndrome. This Wednesday evening, the 12th of June, at the Roselle Center for Healing in Fairfax, we're going to be doing an evening on fibromyalgia, chronic pain patterns, understanding the differences, but more importantly, understanding what you can do about it. If you're tired of, basically being on medications and that don't work and you're getting hooked, you're on gabapentin. Have you ever noticed recently that you go to the docs and they prescribe medication unendingly? Can you tell me what that's all about? I don't know. It's something that really, I can't really put my head to. So, they write a prescription for Cymbalta. They write prescriptions for Lyrica. They write prescriptions for gabapentin and tramadol, even naltrexone. All of this stuff doesn't fix anything. It's treated in a neuropathic pain pattern, trying to block the signal to the brain instead of trying to figure out the why behind it. And if you do the study and if you look at the literature, it doesn't work. You get about 25 to 35%, depending on the author, of resolution. Some even creep it up to 42% that you give some credence, some resolution to the pain pattern. But it doesn't make any sense that they don't ask the question and dig deeply. Why did it start? How come? What's the deal? If you look at the meds, they're going to say, well, they're rated at this level, they're rated at that level. The ones that have had the most reviews, they're rated at a very low level. So it tells me that things aren't working the way it's supposed to. But fibromyalgia medications, are basically based on a psychological approach chemically. And it was found that there's triggers, but they're not understanding what the triggering mechanism is. Years ago, I wrote a paper that you've heard me talk about, fibromyalgia, the undisease. And the reason that I said it was the undisease, you remember 7-Up, the Uncola? Well, that's where I got the term from. I said, this is the undisease. And what it came down to is this: they diagnose and still diagnose fibromyalgia by ruling out other types of conditions. Well, this Wednesday evening, we're going to talk about, the muscle pain, the widespread pain that everybody has. We're going to talk about the stiffness. We're going to talk about, the sleep problems. Well, that's just because you're hurting all the time and it disrupts your adrenal fight-flight system, so your cortisol level is always kicking up, and that's what's keeping you awake. We're going to talk about cognitive function and how that affects that. Again, that's the end result. That's the sequela of these things, but from headaches and so forth. But, here's the deal. Physicians, unfortunately, will diagnose a problem as being something when they can't truly objectively finger pointed as something that it should be. Now, what do I mean by that? So they're diagnosing by ruling everything else out. So if it's not any of these guys, it has to be this. And then they give them the term fibromyalgia. But there's many different ways to effectively treat non-pharmacologically and resolve the problem. In 47 years of practice, unfortunately, I've had a tremendous amount of experience treating chronic pain patterns in fibromyalgia. And I'm telling you that what happens, unfortunately, with these drugs, there's often a wind-up effect that makes it worse because as soon as you get off of it, the rebound phenomena is much worse than it was originally before the drug. And we're going to talk a little bit about that and why these medications don't work. But more importantly, we're going to talk about why there are things that are available that you can make a huge difference and get your life back. I mean, truly, truly, truly get your life back. Wouldn't that be great? Wouldn't it be nice to, make sure that, life was good again? Well, we're going to do that Wednesday evening. So give us a call. Go to 703-698-7117. Register for the class. Please register for the class because otherwise we won't know how many people to prepare for. But also, you can do it by going to drtomroselle.com. Just drtomroselle.com. Click, there'll be a sign there to do it. Or you can go to rosellecare.com. That's ROSELLECARE. Hey, let's talk a little bit about this chronic pain syndrome versus fibromyalgia on the program today. And I'll answer all of your questions Wednesday evening. By the way, you do know that you can send me a note anytime that you want to. Go to drtomroselle.com and send me a note, and I promise you I will respond, and I'll tell you what we know about whatever it is that you have a question about, and we'll make that happen. But chronic pain syndromes, they're usually triggered by things like an injury pattern. Yeah, no kidding, right? Something happens, you fall down and go bump. There's the literature says it also has to do with disease processes. Yes, it can be, but they're disease processes that cause an interruption in the signaling from the body to the brain and back and forth again. So fibromyalgia, though, can occur apparently without the presence of an obvious trigger. My experience says that's not true. And I'm going to lay that out for you Wednesday evening. Just because you got it and snuck up on you, so to speak, it's because they haven't looked underneath the rug. There's other things that could have caused the problem. And so I'll give you a little snippet on it. It could be dental work. That can be a trauma. It could be the way you sit and habitually have a posture pattern that's disruptive to the nervous system. There's always a why is that? Absolutely, positively, there is a why. And we're going to lay those out for you. And I'm going to show you what that means. And I'm going to show you diagnostically what is necessary to come up with a true diagnostic of fibromyalgia. And when you have a true diagnostic, now you know what you're dealing with and you know what the systems are. There was articles that were written years ago that there was no laboratory testing that would show that there was a fibromyalgia problem. Well, that's not true. There is, and I'm going to show you that on Wednesday evening. There's very specific testing that can be done, and unfortunately, most physicians don't get it. They don't want to do it. One takes a little bit of a biopsy. You got to look at the fibrous tissue, these fibrils that are getting irritated. So let's talk about fibromyalgia. Is it a chronic pain pattern? Yeah, probably, because we know that it has to persist for at least 3 months before you can even have that diagnosis. We know it has to affect a whole bunch of different things, but there's some differences, and these are the things that we want to touch upon just a little bit. There was an article that was written by a guy who was assistant professor at the University of Arkansas and their medical science division of chronic pain. And the doctor's name is Shah, S-H-A-H. He's an MD, researcher. And he went on to talk about the feeling of pain varies from person to person. And some people might experience an achy, a burning, a stiffness, a throbbing. It's not so much stiffness, even though that they want to throw that in there. And they went on to talk about that the different things that cause long-lasting pain. They say it can be an infection, maybe only if the infection has to do with the neurological system, causes an inflammatory reaction, and an injury pattern. It could be psychological traumas like PTSD. A lot of our servicemen coming back, that's true PTSD, and people who've had other experiences, awful things that have taken place over the years. Can it cause a problem? Sure, we have the somato uh, problems that are triggered by emotional platforms as well. There was an interesting article, and it was published in the British Journal of Anesthesia, and it suggests that it's more persistent in very specific categories. One, people who are a little older, women. I'm sorry, ladies, but that's what the statistics show. I didn't make it up. I'm just reporting what's out there. People who are in a constant state of anxiety, depression. So why is that? Because now all your feel-good juices are down around your toenails, and that upregulates your body's ability to redirect pain patterns, if you will. So fibromyalgia is characterized by an aching, a throbbing, a burning type of pain throughout your whole body. But it's more than just pain. It also encompasses a lot of different visceral and joint space problems. Now, when we look at a joint pain, the joint itself is not the problem. It's the wrapper, if you will, the fibrous connective tissue that's around or goes over it that envelops the muscle and the tissue and so forth. So when they talk about other things, they're talking about the sequela, the sidebar effects of all these things. So a chronic pain syndrome, let's talk about that for a little bit. And we're going to get these much more seriously on Wednesday evening. It can be caused by an injury, an illness, just like fibromyalgia. But it doesn't necessarily affect the whole body, where fibrous or fibromyalgia has to affect everything all at one time. That's one of the distinguishing factors. Nerve involvement in a chronic pain pattern, has a results from a physical problem, if you will, and it can be due to trauma or nerves that recoil and they wind up and cause, a distant problem. It can be a result of degenerative disease like arthritis or repetitive injury patterns to one area of the body. They talk about a chronic pain syndrome that should be there for more than 12 weeks. Well, fibromyalgia, by definition, has to last at least 4 months. So, there's a lot of overlapping here that's really confusing. So we're going to go over that. We're going to break that down, and we're going to compare the two of them and make sure that you understand that there are distinguishing characteristics between a chronic pain syndrome. In my opinion, fibromyalgia is a chronic pain syndrome. But the differencing pieces are that in a chronic pain pattern, you can often come up with traditional laboratory tests that will show you that there is this, whatever it is, going on. In fibromyalgia, according to the literature, you cannot distinguish it by traditional laboratory testing. Again, the medical community rules things in because they can't find it someplace else. So that's kind of interesting, right? Well, it can't be this, so it has to be that. That doesn't make sense to me. Never has, particularly when there's very specific indicators that show this. So Wednesday night, we're going to kind of distinguish between both of things, but more importantly, we're going to teach you how to fix it. We're going to show you where the problems are coming from, what has to be addressed to really put this into a quiescence, and how you can begin to down-regulate the nervous system. I'm going to teach you a couple of things that you can do, on your own, which is important, right? You have to make sure that you have the tools, and the tools simply are available to you if you know where to look and what they are, and not say, you have to take this medication for the rest of your life. I don't think so. Not something that, I'm very interested in when I know that there's other things out there that may make a difference. So we're going to go over that. We'll look at the visceral problems as well that seem to show up. Some people talk about constipation. Why is that there? We're going to talk about extreme sensitivity to sound and light and smells. Well, if you're hurting all the time, wouldn't you have extreme sensitivity to those things? I know I would. Like a kid yelling all the time. Are you willing to put up with that? No. In normal circumstances, you want to put your arms around them and love them and hug them and take care of them. But in other situations, you want to, I know, hit them with, you know, a limp pasta noodle or something. I don't know. But listen, that makes sense, right? You don't feel good. You're not, your tempers are very, very short. So we're going to talk about why memory is problematic and how with chronic pain patterns, you don't think the way you should, and you don't remember the way you should, and you don't assimilate information the way you should. So we're going to talk about how did it start, and we're going to talk about severity and how it can crank up, and we're going to talk about is it constant or does it come and go, and how's that a distinguishing characteristic. We're going to talk about the sharp and the burning and the throbbing. We're going to talk about things that make it better, make it worse. We're going to talk about where it's located, and we're going to talk about the 11 out of 18 trigger points that have to be present before you can call something fibromyalgia. Or if you only got 7 or 8 and now it's a chronic pain pattern. Yeah, it kind of gets confusing, doesn't it? Well, I promise you on Wednesday evening, we're going to clean that up pretty good. There's, once you figure out what's causing a chronic pain problem, you can treat it. If you can't figure out where it's coming from, you just throw medications at it. Antidepressants, as we said, Cymbalta and Elavil and, all the other crazy things, anti-seizure drugs. Why would you give an anti-seizure drug? Why would you give Lyrica? Why would you give Neurontin? These are things, Neurontin, by the way, is gabapentin for those of you who don't know the translation. Why would you do that? Because you're just throwing stuff at the wall to see what sticks. You're trying to dumb down the experience so the body cannot appreciate what's really going on underneath it. And unfortunately, in today's world, traditional medicine is treating symptoms. They're not treating the underlying why is that. If you heard me lecture, you've heard me use that hundreds and hundreds of times. The problem that we have is that when we treat these types of pains with medication, we use opioids. They come with very serious side effects like memory loss, dependence, addictions. The opioids can relieve pain in a short period of time, but they take more and more. And then the pain, as I said, winds up and it comes back with a vengeance. It's not okay. So we're going to show you how to fix that. But it's a two-way street. It's stuff that you have to know about, and you have to be willing to make a couple changes. And we're going to tell you what those changes are and why they're necessary. And we're going to get into this whole pathway. We combine multiple approaches when we look at any condition at the Roselle Center. And we have some great guys that have come up with some significant applications. Unfortunately, one of the things that we've seen recently, too, is the exacerbation of pain patterns because of the COVID vaccines. It's a gift that's going to keep on giving until we break these spike proteins that are initiated not only by the viral pattern, but also the medication, the vaccine. So there's ways of getting rid of that too, and we can talk about that, and I will entertain any questions that you have. I have a feeling this night's going to go a little longer than usual, but we're going to be right there at your beck and call and making sure that you understand what the process is. Join us this Wednesday evening. Go to rosellecare.com or call the office, 703-698-7117. And remember, if you have to cancel, please do so we can make sure we have enough room for everybody else. Give us a way to get a hold of you. So if we have any shifts in plans that we can do that. We're not going to solicit you. We're just going to let you know what's going on. But we're going to tell you where those trigger points are. We're going to tell you what they really mean. We're going to tell you how to handle them. It's really important that you get it. It's really important that you have the tools to really understand that you have a choice and make a difference. And we're going to do that this coming Wednesday, the 12th, 6 p.m. at the Roselle Center for Healing in Fairfax. By the way, just as a sidebar for me, I want to remind you of something. Tuesday this week is primary time. And those of you in the state of Virginia, get out and vote. It's really important. You have to really take a look at what's going on. Your health freedom is at stake. And it's important that you vote for the people that you know that will support your right to choose. And many of you know that I've been involved with an attorney. His name is Jonathan Emord, E-M-O-R-D, and he's running for the nomination for U.S. Senate. I've had the privilege and the pleasure of working with him, and he's very much supportive of your ability to choose how you're going to be treated, how you're going to pave the way in your health care. He's been up against the FDA at the Supreme Court level and has won 7 times. He's a guy that, because of his history and what he's done at the Supreme Court level, that you can see people like me and your insurance companies have to pay for it. He's the guy that forced the insurance companies at the Supreme Court level to come up with a diagnosis and force them to pay for nutritional deficient conditions like cleft palate. We used to call it split lip. Well, that was a result, and still is, of not enough B12 and folate during pregnancy. And it wasn't recognized until he went to the Supreme Court level and won there for you. So that's where my vote's going. I'm not going to tell you what to do. I just want you to take a look at who's going to support you the best way possible and make it happen. But we're coming up to the end of the program. I want to invite you this Wednesday evening. Please join me. We're going to have some fun. I promise you, you're going to walk away with a lot of information, and we have to make sure that, it's true, it's honest, it's straight up. It's something that you can take home with you and help not only yourself, but help others as well. Follow me on all social medias so we can let you know what's going on. If you're on Facebook, if you're on Instagram or Rumble or any of them, follow me and we'll let you know. It's important. This is why I do what I do. You need to have the information. In this situation, we're going to be talking about, widespread pain patterns that seem not to go away. But I promise you, this coming Wednesday evening, the 12th, you're going to walk away with a ton of information. You're going to probably know things that your physicians have no clue about. Just remember, I'm here every week for you and continue to be here for you for one reason only. You deserve it. I love you all. Have a great Sunday. Take care of yourself. Bye.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Fibromyalgia on Wednesday, June 12th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.